continuing our Care in Canada series here on the show, diving into the state of the country's healthcare system. And today we're going to be talking about solutions.
Since it's International Social Prescribing Day, we thought it would be a perfect opportunity to talk about this increasingly popular healthcare practice. So here to tell us all about it is Kate Mulligan, the founder and scientific director of the Canadian Institute for Social Prescribing. Hi, Kate. Okay, so start with the basics. What exactly is social prescribing?
You know when you go to the doctor and one of the first things you're asked is, what's the matter with you? That's the view of our clinical healthcare system. Social prescribing is a way to flip that script to start by asking what matters to you and connecting you to non-medical, non-clinical supports that can help you. Things like time in nature, spending time with other people, arts and culture, pet therapy, you name it. All of these are things that we know are good for us, but sometimes we need a little bit of a boost, a little bit of structure to help us connect to our communities again.
Okay, so what does yes to all of it, yes. Okay, that's saying it. What does this look like in practice?
So imagine your neighbor is going to see her doctor repeatedly, but the doctor can't find anything clinically wrong with her. And it turns out she's going because she's lonely. She needs someone to talk to. This is hard for her, and it's hard for the doctor too, because our system just isn't set up to help with that. So what they can do is do a social prescription, make a referral to somebody who has more time and more resources to help with those social factors. So it's called a community connector or a link worker. And that person slows things down and works together with the person to come up with something that's most meaningful to them. Maybe your neighbor used to be an artist and really wants to reconnect with time to be in arts. Maybe your neighbor is struggling with dementia and would really benefit from being part of a choir to help reconnect her with music and movement. All of those kinds of things are available to us if we take the time to make that referral. And then follow up and see, does it affect our health? Does it improve our use of healthcare services? Do we feel better about participating in our communities? And so far, the evidence really shows that, yeah, it's working.
Wow. I love this so much. So this isn't being positioned as a replacement for healthcare, obviously, but so how do you see it fitting into the larger system that we have right now?
It's not a replacement for healthcare that you need. Lots of us need clinical care. So imagine it like if you have a broken bone, your doctor heals the broken bone, but social prescribing gets you back to dancing. It's the thing that really gets you back into community. And it's something that we've lost. We've lost individually, particularly after the pandemic, when we're kind of got more used to being at home and less used to being out in our communities. And it really works. And I have experience in my own life with my own young daughter who's 10. She underwent brain surgery, which was a clinically necessary thing that we're very grateful she had. But it was pet therapy, therapeutic clowns, an in-hospital school, all of those kinds of social supports that really made her life worth living again.
Yeah. Wow. How is she? Yeah. She's doing okay?
She's doing really well.
Great.
Thanks.
You know, we've talked a lot about on this show about the healthcare system being in absolute crisis across this country. It's supposed to be universal healthcare, but it's not accessible to all, and there's a lot of challenges. So how does social prescribing help maybe alleviate some of the pressures that we're seeing in healthcare?
There are a few different ways. One, it's a lot cheaper than acute care, right? We can get people involved with peer community health workers, even as volunteers. We can get into community programs and organizations that are a lot less expensive than surgery, pills, and other things, which we sometimes need, but we want to get in there earlier. We want to get and move toward a more preventive health system. The other thing that it does really, really well is it takes some of the stress away from those very, very overburdened frontline healthcare workers. Those primary care providers who want to help, that's why they got into health and medicine, but they only have 10 or 15 minutes per patient. They have a lot of admin work, and they have a lot of other pressures, and they aren't trained to deal with these social factors that really influence our health. In fact, 80% of our health and well-being is determined outside of the healthcare system and in community. Things like housing, food, income, connectedness to other people, a sense of belonging, a sense of purpose. So social prescribing helps those frontline healthcare providers get their sense of purpose again too, and relieve some of their daily burden by taking care of people somewhere else. So it's a win-win.
I love that.
It's so good.
Love that.
Yeah. I mean, let's get down to brass tacks. We can't talk about healthcare without talking about costs. So what would social prescribing be taking away funds from other healthcare services?
If we put one community connector or link worker into every community across Canada, it would still cost us far less than 1% of the overall Canadian healthcare spending. It's really, really affordable. Yeah.
Wow.
We've done research too that shows for every dollar that you invest in social prescribing, you get a return on investment of more than $4 in healthcare cost savings.
Wow.
And an increased social and economic participation for people. So we did that with KPMG Canada, who crunched the numbers for us, and it's looking really promising, not just here, but all around the world, especially in the UK where it got started, and they're doing it nationwide.
Wow. So let's talk even more. I mean, we have the anecdotal discussion you had about your daughter, for example, but what other proof of success have you been able to witness? What's the data?
One of the best things that I've seen is just over the last 3 years, we've gone from just maybe 1 or 2 pilot projects of social prescribing to see it happening in every single province across Canada.
Wow.
So people are seeing the difference. I was involved in one of those early pilot projects here in Ontario where community health centers tried out social prescribing in 11 different communities, urban and rural, English and French, northern and southern, lots of different types of contexts, different types of people. But what we saw across all of those was a 40% decrease in self-reported loneliness, as well as improvements in people's health and healthcare providers saying people were coming in to see them less often because they were getting those needs met somewhere more appropriate than the healthcare system.
Wow. Okay, so let's end it with this big question. If you are watching us, you're in Canada, if you want social prescribing here, do you just ask for it?
Yes, you just ask for it. It's not available absolutely everywhere, and that's what we're working on, trying to make it a regular part of our healthcare system. But you can go to our website, which is socialprescribing.ca, to find out if it's happening near you. We've got a map of initiatives all across the country, and we have lots of fact sheets that you can download or take with you on your tablet or other device to your healthcare provider and say, this is what I want. And the more we ask for it, the more we build that demand, the more we'll show the healthcare system that we want this, we need this, and we're ready for this.
Kate, thank you so much for being here today. So
Great
wonderful.
advocate.
Oh my gosh. Start Googling now. Don't go anywhere. We're going to be right back.
Hey, you, come a bit closer. We've got so many more must-see interviews, spicy debates, lifestyle tips, and pop culture moments. So subscribe to our channel by tapping the logo below and don't miss out.